Welcome everybody. My name is Nicola Mackintosh. I'm a professor in social science at the University of Leicester, and I'm also the co-lead for the Enhancing Cultures of Safety at the Greater Manchester Patient Safety Research Collaboration. And yeah, welcome you to this afternoon where we're going to be exploring what Moments is and how it's been applied, and hopefully giving you a chance to either share some of your own experiences or share some of your ideas and potentially ways that you might think about using it. So I'm going to just explain the structure of the afternoon, of the hour slot. So I'm going to do a quick presentation for 20 minutes, and that's really going to share how we came to devise Moments, so the research underpinning it, but the principles of what Moments is about. And then I'm going to bring in, I'll stop sharing slides, and then I'm going to bring in two people, Matt and Jill, who can introduce themselves when they come in, about their own experiences of using Moments, and hopefully they'll be able to give you sort of different varied examples of how they've used it in practice. Then we'll open it up to the floor to actually come in with questions and answers. As there's quite a few people here, what we're going to do is monitor the chat. So do pop your questions in the chat. And if you see a question that really resonates with something you'd like to ask, do like it so that we can get a sense of the popular questions. And then when we open it up for Q&A, we'll respond obviously to hands, but also to the chat, and we'll manage that. Okay, so yeah, just to say hello again, I'm a professor in social science applied to health at the University of Leicester. And I'm here to talk to you about Moments, which is about meanings, competencies and materials in everyday team safety. So I'm going to talk a little bit firstly about the research that underpinned this project. So we're based at the University of Leicester, and it's a group called SAPPHIRE. We're an interdisciplinary group of researchers, of sociologists, psychologists, anthropologists and clinicians. And we draw on social theory and qualitative methods for applied healthcare and improvement research. And a group of us were involved in both the research that underpinned this, but also the development work of Moments. So you'll all be very familiar with the background to this piece of work. There's a long history of sort of high-profile inquiries, high level of media interest, powerful advocacy groups, and basically cultures of safety have been implicated in these reports over a number of years. They use quite broad definitions of safety culture, and it often is used as a term really to imply sort of any safety related phenomena, which can be quite unhelpful when sort of everything is grouped as a problem with safety culture. And it can be quite difficult to know what to do with that and where to sort of concentrate efforts to improve that. We also know that in terms of national ambitions to reduce stillbirth, there are enduring inequalities, particularly in Black and Asian populations and social deprivation. So it's a complex sort of background context to this work. So our starting point, we were commissioned by NHS England to sort of undertake a qualitative piece of work looking at safety culture across maternity and neonatal services. But interestingly, the point of this was to actually focus on what was working well. So to take a different standpoint to looking at the inquiries and some of the reports about the problems, the starting point for this piece of work was to actually see if we could unpack how do we know when things are working well. And so we were really interested in sort of trying to pull out some of those relationships and subcultures at ward and unit level. Now, in 2018 and 19, NHS England had undertaken a culture score exercise across all of the services. And so we used this, this sort of rating, this assessment as a starting point. But interestingly, we weren't really interested in the scores themselves in terms of objective measures of safety culture. We were more interested in what they signified. So how did those scores come into being? What did they signify? And we were thinking very much as culture as this sort of background the processes by which things, persons and concepts become invested with meaning. And as I say, this was a qualitative study across maternity and neonatal services. So our aims were to explore qualitatively relationships between safety culture, interventions and context. And we were always, right from the beginning, interested in the role of interventions that are labelled as cultural interventions as to how they worked. But we were looking at 3 different levels. So we were looking firstly at leadership levels, so what enabling factors relate to leadership actions, and how does that enable and set the precedent for how safety culture becomes embedded in work. And then we were interested in those sort of much more at a ground level. How does that become enacted in everyday practice? And then thirdly, we were looking at what things help hold that in place, so where things are working, what sort of soft and informal measures actually enable this to take place, as well as the more formal. So our design was, we selected 14 organisations that had scored very highly on the SCORE survey, and we were looking for organisations that had good response rates as well. And so we approached 14 organisations and 10 agreed to actually participate. And we started off by doing scoping interviews with 13 service leads. So we're talking about directors of services, heads of service. The point of that exercise was to really try and understand how they'd used the survey, but also how they made sense of where they were at in terms of their safety culture. This study was done in 2021, so as you can imagine, this was in the midst of the second wave of COVID. So we had originally hoped to do an ethnographic study, and it defaulted to an interview and focus group study because of COVID. From those scoping interviews, we then purposefully sampled, and we were informed by geography, demographics and diversity in the data. And then we carried on sort of further down the organisation by doing interviews with clinical and safety leads, and then doing some focus groups with doctors, midwives and allied health professionals. So what did we find? It won't be a surprise to you to find that we found these domains of interest around compassionate leadership, around team working, around responsiveness to service users, as well as in terms of boundary working, people working across services as well as within, and issues also in terms of risk management, in terms of sensitivity around managing risk and governance, and lastly around quality improvement. I think what we found really interesting was when people talk to us about how they made sense of safety culture, they defaulted often to talking about the practical things they do. And so for each of these domains, we were able to identify practices such as leadership walk-rounds, having an open door policy, working clinically, safety huddles, multidisciplinary team working, in terms of walk-rounds with service users. Those sort of practices was how they actually made sense of how their teams and organisation at that local level were working. But what was interesting for us was it wasn't just noticing that they did these things, it was how this was done. And what was imperative really for our understandings was about the values that were enacted through these processes. So you could have a leadership walk around, but it was only really talked about it being effective when they started to talk about the values that actually were implicit and evident through that practice. And I think some of these stories that we heard during our interviews really started to sort of get us to think about this relevance of these local practices. So we came away from that study really thinking about the everyday is a good window into actually understanding how things are working more collectively. But importantly, it was this idea of trying to tease out what values are enacted through practices and when things feel congruent with how they're supposed to be set up. And it gave us a really good understanding of what good looks like, and this idea of having a window of being able to see almost that background safety culture context that is informing everyday work. And so we started to think about whether we could use these individual sort of collective practices almost as a vehicle to do some further work, and that these practices could give us an opportunity to understand, but also potentially to think about how things could be done differently. So these occasions could actually just be a vehicle, as I say, for us to think about safety achievements. And I think one of the things that stuck with us is the participants in our study found that in being involved in the study and actually undertaking the interviews gave them a reflective space to think about these things differently. That was one of the other things we came away with, is this idea that often clinical work is about doing, getting through the day, and there's very little space for reflexivity and thinking collectively about what we do. And so we also thought maybe we could design something that actually gave permission and legitimacy for this. So how we took this forward is we started to think sort of more in terms of that, in line with Safety 2 approaches that think about how safety is managed on an everyday basis. So rather than thinking just about the problems, what happens every day that perhaps we don't attend to? And by attending to this, could we actually see things and talk about things in a different way? And we also wanted to move away from seeing cultures of safety about just individual practices, but thinking much more as shared collective activities across teams. So moving away from behaviour change, but actually trying to think much more in that collective space. We also were really interested to see it as a much more relational side of safety culture, rather than seeing it as quite static and structural, but this much more relational and involving on a day-to-day basis. And actually thinking about how safety cultures in a way are accomplished every day. How do we do this work on a sort of everyday basis? And so we started to think about what theories could help us unpack this, and which is why we then moved into thinking about what's called social practice theory. And social practice theory is very much work on this idea of grounding in practice, the everyday, the doing, the action, but as a lens to actually then look up and look at the social and cultural that actually enables us to understand things in a new way. So we were lucky enough to get some follow-on funding and did a piece of translational research with NHS England. So we worked with this idea of social practice theory as a theoretical sort of framework for our work. We also worked with a creative company, Nifty Fox, who acted almost as a mediator between the different groups. And we started to think about whether we could use these collaborative occasions as our starting point, thinking about things like handover huddles, team meetings. And we undertook some stakeholder workshops with PPIE groups and also with our interviewees that had participated in the research, as well as some wider stakeholders. And then we also piloted our resources within 4 trusts. And the key here was we wanted to work with staff to enable reflexive insights from within teams. So rather than us coming with a solution and imposing it on others, we wanted to provide something, a framework that teams could then work with themselves. So we created this framework called Moments, and there are sort of 4 key elements to this. So the 3 structures that are used traditionally in social practice theory are around meanings, competencies, and materials. And what we also were interested in is the central component, the values element to this. So how do values come into being through this practice? And I think the elements of Moments that are quite key for people who haven't used it before, there are sort of 3 threads to this. One is around the use of metaphors and the cup of tea, which I'll come on to. It also ideally enables storytelling, so people to actually have the chance to give their version of what they see is going on at work. And lastly, to provide this sort of loose structure that it can enable people to come up with solutions themselves. It gives some sort of concrete structure, but it also enables agency for people to take it in directions that they want. So Moments isn't a solution, it's an aid to start collaborative, critical conversations. And in that sense, it's quite different to a lot of the resources that are around at the moment that are much more around this is a prescribed way of doing something, a solution. And I think in that sense, Moments does need to be set up because it's not perhaps what people are used to. So this idea of it providing a space to rethink things, and also it needs support from management really for that flow science, for space and time for reflexivity, and that's quite important. So I'll just talk about the cup of tea metaphor, which is part of the resources. The practice of making tea has been part of healthcare settings, and it can demonstrate care and compassion. But we do know we need materials. You need access to a kettle, tea bags, cups. Also, competencies. So staff need to know how to make a good cup of tea. And that sounds obvious, but actually we all know that we can be served a pretty rubbish cup of tea. And it's something we teach our kids in terms of skills. And also there's a sense for healthcare staff about when is it okay to have a cup of tea. So you really need to understand the local norms to actually know when a cup of tea is a good thing. But importantly, there are meanings attached to a cup of tea. It can be an act of care, it can legitimise time away for a break, it can be a conversation opener and a leveller. And importantly, you can see the values that are enacted through that cup of tea. It can demonstrate care and compassion. It can convey openness and authenticity, attentiveness to staff well-being. So something very simple, like making a cup of tea, you can see can tell us a lot more behind that practice. So Moments really asks staff to actually choose a practice and to reflect on different components of it. So the first of which is the competencies. So who's involved in that practice? Who brings competencies? And are the right people there? In terms of materials, this is a really important component because as well as people, there are things that make up practices. So that can be in the level of information, but it also can be about geography and space and some of the bits of paper, the physicality of resources that we work with, and things like training. Importantly, are the rules about the practice. So when we all move to a different area, we very quickly learn about what is acceptable and what isn't. So what things are talked about, what things stay under the radar, what is publicly and socially sanctioned, perhaps by senior people, and what's given social approval. So through that practice, we can really start to see what things govern. But importantly, what values are enacted through that practice. So it could be that the practice has been set up to enable safety and to enable sort of safe conversations, but actually somewhere along the line, the practice has become a bit disconnected from how it's supposed to be. And actually give staff the opportunities to say, this works really well from a relational, collaborative safety perspective, but actually that practice is not working nearly so well, and to tease out some of those differences. So we've set up a set of resources on the Moments website, and it consists of a facilitator guide, who is the person who's going to be leading the session, a table facilitator guide, which if you've got a number of different tables and people on, can help guide those conversations, as well as exercises and a worksheet. So the facilitator guide very much sets the scene, its aims, suggests different types of practice that could be selected, and then goes through the worksheets with key questions and discussion points. Whereas the table facilitator guide focuses much more on the doing, how do we enable conversations, who's in the room, how do we be attentive to them. And I think the maternity and neonatal use of moments has been really shaped by NHS England's building this into the infrastructure of the patient safety collaboratives, which has really helped enable sort of widespread training, but also there is that infrastructure there that can help embed and support people locally as they sort of work with whatever efforts are happening in their own trust. So I think this local ownership and sharing across communities of practice is an important mechanism for thinking about how moments can be supported and sustained. So just coming to the end of the presentation, where Liz, who's the researcher working with me, who's also here today, and I are doing some follow-on work, really trying to understand whether we can take moments which started off very much in maternity and neonatal services, and we move it to different environments. And we're looking at the moment at how it can be used within general theatres, and actually working with ODP surgeons, nurses and anaesthetists. And we're seeing how, without that infrastructure that the maternity and neonatal services have got, how would that work in practice? And thinking about, do we need to actually identify additional sort of supportive implementation guidance to think about moving it across sectors? So I'm going to finish there really with my reflection that we've had really positive engagement through the patient safety collaboratives. And we've had a lot of hits to the website and some international hits as well, which seems to be sustained, which is great news. We've also got a real sense that it has got this local value in terms of enabling local conversations and local solutions. And we've got a real sense of varied examples of use. So we've got a sense of people using it for particular practices and coming up with things like designing team charters for how to manage team meetings in a more productive and relational, safe way. We've also heard about people who are using it for much more ongoing cultural conversations with cultural coaches and building that into ongoing development work. And thirdly, we've heard from people who are using it almost to support implementation of other innovations or interventions that have a cultural aspect, such as Martha's Rule, such as PSRC. But I think for us, it's important to think about the impact as much about the process. So it's this idea of actually enabling relational, social learning about the things we do and tinkering with maybe we can change things at a local level. But I think there's always that sort of tension around how do we demonstrate impact that feels slightly at odds with something that is very localized, such as this. And I think lastly, the caveat that I would say is Moments was never designed to be the only cultural framework or sort of resource. So I think it's important to be aware of its limitations and the fact that we do need more structural support in terms of leadership development and thinking about some of the structural solutions, as well as something like this that is very much based at local team level. And we're just starting to think about the enabling conditions that we might need to be attentive to, which is very much around this management support for space and skills and facilitation for Moments moving forward. So I hope that made sense to people. We'll come and have some questions that may relate to the presentations afterwards. But what I'd really like to do at this point is to bring in two people, Jill and Matt, who've been working with Moments for quite a while, for them to share their own personal experiences of how they've used it. So I'm going to hand over to Jill there. If you'd like to introduce yourself.
Thanks, Nikki. Good afternoon, everyone. My name is Jill. I'm a registered midwife by background, and I'm a senior project manager at Health Innovation West of England. So I've been working with the team on the Perinatal Culture and Leadership programme. Matt, did you want to introduce yourself before I go any further?
Yeah. Hi, I'm Matt Hermix, anaesthetist in Plymouth, and I was the National Clinical Advisor on Safety Culture at NHS England. when we started the work on moments.
So Jill, do you want to say how if we give us some concrete examples of how you've been using it, that would be great.
Yes, so we've had a little bit of a multi-pronged approach on this one. So we have been working with our colleagues at the University of West of England, and I think Emily's on the call, with the second year cohort of pre-registration midwives. And we've integrated moments into one of their modules, which looks at quality improvement. So it's giving the opportunity for those learners to come and discuss their practical experiences. So what's been happening for them when they're actually in their clinical placements, breaking those down a little bit, and then enabling them to help identify potential quality improvements. So the module assessment is a quality improvement proposal. So we go through some QI work as well, but the majority of the sessions, so we use a whole hour of a 2-hour lecture to go through the moments tool to help them to break down what they've been experiencing. We've had some really powerful feedback from them. And I've got a couple of quotes that I just thought I'd read out. So one of the quotes from one of the participants in the summer was, "What was useful for me in this session was gaining a deeper understanding of what contributes to a positive safety culture, especially through a strengths-based approach that focuses on what's working well rather than solely on errors or incidents." So it's really good to start getting people thinking about actually what have we done well in this instance, as well as where are those opportunities for improvement. And one that made me really smile, as newly qualified, soon to be within our systems working with us, is that someone reflected that the session was incredibly insightful, and the main takeaway for me is to not be afraid to speak up. And I think that's part of the culture within the NHS that we've been working towards for a long time, is getting that freedom to speak up culture. And it's really enlightening to see that the students, the pre-registration learners, are taking that from the use of this tool and those discussions for potential improvements. We've also been using the moments tool within prompts, so our emergency skills drills for one of our organisations. So we are aligning it with PSRC. So as you say, it does align really nicely. So within PSRC, you've got that workers imagined versus workers done element, and moments provides that opportunity to objectively look at a process or clinical practice for a team who may not usually be comfortable, especially with PSRC being relatively new and people not being overly familiar with the conversations, with the discussions and the processes around it. So it helps provide a tool that can be utilised across different discussions to support teams feel safe, so that they can actually raise what was happening for them at the time, what worked well for them in that situation, maybe what was missing for them. And we continue to use the cup of tea metaphor, and particularly around what workarounds have been implemented within your local practices. So we tend to refer to the magical mystery teaspoons within the NHS, because you get them and then within 24 hours they disappear. So what is a routine practice for you for how do you stir your tea? You know, I'm sure people that are attending at the moment are thinking, well, I've probably used a fork before, maybe I've used a knife. We've got those little wooden stick things that don't really hold the weight of the tea bag. Some people talk about how they just grab the tea bag with their fingers and they just hope there's a bit sticking out the top. And then they talk about potentially using a straw. Excellent, thank you. We've had others that have gone, oh, I sometimes use my pen, and I've gone, oh, infection control, probably not the best practice. So then we start to explore, what do you need? What would be a better process for that? So we can really get into that PSRC sort of after action review segment, but through that use of moments. So it then feels like a familiar tool for conversations moving forward. And then, as you say, we've got culture coaches as well. So our local training, we are aligning the culture coach. So what is the role of a culture coach? How can they support in practice? And then bringing in the moments tool as a framework for culture coaches. Someone is just speaking in the background. Sorry. But yeah, so what is the opportunity for us to bring in that tool? So we're looking at it as a framework for conversation for our culture coaches, so they've got a tool so they feel like they're prepared to go and have those conversations in practice, because some of the initial reflections we had were that I understand, but I'm not sure how to approach it. So having something that has multiple threads, maybe the students in their organisation are already using it because they've attended lectures if they're within our West of England region. So actually it helps teams then come at it from different facets, so it becomes familiar and a little bit more comfortable.
Thanks, Jill. That's brilliant. Great. As I say, you will probably be drawn in later when people ask maybe some more specific questions, but I'm going to bring Matt in at this point as to if you can just explain a little bit about how you've been using it.
So yeah, it's involved in a lot of the testing of moments as we develop the tools that support the conversations, and I suppose a lot of that came from the learning we had previously, where we spoke about culture over here and the work over here, and we sort of kept culture and the work separate, and the two never came together. And I guess that exploration of how we do things, so this isn't an intervention that's going to say fix your culture, but how we do things really matters, and that relational approach that Nikki was describing is absolutely crucial to this. So involved in the testing, which is a lot of fun. There's always been a lot of energy in the rooms when we were using it, and teams seem to really value that time and space to come together and talk to each other, understand the different perceptions of the work. There's often some quite different perceptions amongst different work groups about how work was actually done, what actually supported it, and what may have inhibited it. Some of the wonderful examples about teams were handover rounds where the student midwives would come in and they thought they weren't allowed to sit down on the chairs. And just little bits like that about how that inhibited their participation and ability to speak up and share their perceptions really make a difference. The bit about how we do it is sort of almost the meta piece in the process of doing the moments as well. So how we are in that space as well is starting to create those relationships, that cultural shift, and you can sort of bring it up a level as well and go, how were our competencies and meanings materials and what all our values were showing up in this. Something that's people struggle with sometimes is just understanding how those values are really showing up with some of the learning we had. I had a midwife who was telling me she was always compassionate. So how does that show up? What are your pieces that have these that really show that compassion coming forth? And it's just those little gestures that she then described about the pausing, the checking in, the smile, that just actually stopping and listening, even making a cup of tea at times, and there's some self-compassion in there as well if you make one for yourself. Just how those values really show up. And they often come up as people talk about the competencies, meanings, materials. You still got to put them to one side. We're going to come back to those values in a moment. But sometimes they really do come up, and sometimes there's a bit of nudging needed, and just to understand those little gestures and responses that really make those values come to life in those moments and how valuable they are. And just sort of giving an illustration of how it can feel differently. One team were describing a management corridor, and their open door policy was truly wonderful. It was a long, thin corridor. They often wanted to get to the room at the end, and to get there involved walking past all the other offices, and people sort of look up and see if they're coming to them, which is fine if everything's going well. When you're in tears, you feel a little bit more vulnerable to walk along that corridor and get to the end. And so things set up with really brilliant and the best intentions were having a different feel depending on where you were in the team. And just as insights allow us to start thinking about how do we do this differently? How do we do a little bit better? And the final reflection before I sort of let it come up into questions is that we'd often ask teams whether this was work. Is this hour and a half of coming together work? I go, no, it's not. And it's that bit about this is the work. This is how we come together. This is the oil that really helps us get through the days, understand how we are as a team and what really supports us and how we move things forwards. So I guess it's that shift in how we think about things from the just doing and getting on and keeping going and activity matters, and think about how we do it and how we create these pauses and times for the reflexivity that's so important, understanding our local culture, getting to know each other, and the bits that really make a difference to being brilliant in our work. And I'll pause there.
Thank you, Matt. So yeah, I think Matt and Jill have given, I guess, different ways of using it, as you say, as to whether it's giving permission to have those conversations about what we do every day, or whether it's more targeted around an intervention. And I think the idea is, I think Emily said about bringing it into training from that early stage is really lovely. It's actually sort of normalising that this should be part and parcel of everyday work. But I want to open up now for questions. It seems like the cup of tea does seem to resonate with people, but I'd really love to hear, we would really love to hear if people have got their own examples of perhaps where it's worked well, but also if people have found there have been challenges. It would be really great to hear that side as well. Okay, Maxine, can Matt and Jill talk about how to get buy-in for the slow science, both from leadership and from staff on the floor? That's a great point. Yeah. Who wants to pick that up?
I'm happy to say how we've approached it in terms of getting buy-in locally. So for us, engaging the senior leadership team has been really powerful, but actually getting in with colleagues that I already know within the system, so people that have come to our maternity and neonatal events for our health innovation network. We try and do one sort of in the spring and one in the autumn. So what we've been doing is running a moment session within that, because there are different people that attend. So you've got obstetric staff, neonatal staff, you've got leadership, you've got clinical, you've got administration. So you've got different people from across the service that will attend that. And it gives people the opportunity to go, do you know what, actually, I think that might work here, which is how we got into Prompt. So some of my colleagues came to our day in April and said, do you think we can run this alongside our shoulder dystocia station? So we're doing the risk, I'm leading the risk management section for them on PSRC, and then we're integrating the moments. But we've also had, at our last day in October, we had more of the leadership teams there. They got to experience moments more, and they went, actually, this could be really useful for our teams. How can we integrate this? How can we do some local training so that more of our team are trained to use this tool so they feel confident in doing so?
Thanks. Yes, sort of plays into my view of leadership, I suppose, about why leadership matters so much in culture. And I guess it matters in lots of ways. Yes, they role model, but they also control resource. They control the time and the space to create the room for this to happen. It also means they control often, or nudge, what we talk about. I suppose that's where moments comes in, other bits that matter about our values that play out. I think it's a big piece about going, can we give it a try? Just that, so it's not a, we're going to do this forever now, but just, can we just give it a try and see if it works? So that almost the vulnerability in there as well of saying, let's try and let's learn together around this as well and understand how it works. Does it work here? And as Jill was saying, those spaces that are already there, so the prompts, other bits, people do have away days, how do you get into those? So I've used it quite a lot of other teams outside of maternity, there are away days as well to shape some of the work. And in part of the design, we also try to keep it down so it could be done in 1 hour. That's tight and leads up energy, but an hour in my head as a clinician, I can get away for an hour, start putting to 2 hours, and it starts getting a little bit tighter about how I free that time up. So a bit about the timeliness and effectiveness, and just growing it slowly, getting the feedback from teams locally, and about the positive effect it has, how it feels, how stuff surfaces, and just really share the good news from it. It's been really positively received everywhere I've been with it. So yeah, just think about those opportunities that are there, and yeah, go gently.
Yeah, I think one of the things, just to pick up on that, is I think from my experience of it, I alluded to it earlier, I think it does take some setting up. So I think obviously with experienced facilitators who are used to and confident with working with moments, that's a different sort of set of circumstances than if somebody as a facilitator isn't clear with it, which I think speaks to Matt's idea of going sort of gently and actually sort of experimenting perhaps with work that they feel safe to do so. Because I do think there is a point, and we learned this in the pilots, that staff are often expecting to be told what to do rather than this is a tool that actually offers you to think about solutions. So it's quite a different way of working. And again, that sort of giving permission to just chat and talk and see that that is important in itself. So I think there is a piece there about actually how do you set that up. And I think there is also an issue, well, not an issue, I think we're starting to think about whether moments can, if people don't feel there is that management and leadership support, can moments provide a framework to unearth that, almost to highlight that issue as to actually how best to move forward with that? Matt?
So just as you were speaking, I was thinking, and you don't need to get through the whole thing in one session. You can break it and come back as well. So if the conversation's so great and it's just on the competencies, meetings, materials, playing that back in later as the values piece can work equally well as well. So it doesn't have to be all within one session.
Yeah. Right. There's a question here about from Claire. You've mentioned facilitation by a culture coach. What training would such a person have? Could an experienced PSR or patient safety specialist fulfill this role, or does it need to be a psychologist or other? No, it doesn't need to be. I mean, I think no, but anyway, Jill, I mean, in terms of the culture coaches, does one of you want to talk about that?
I mean, I'm happy to cover what our local culture coach training sort of covers. So our local culture coach training goes into what is culture, how do we understand our local culture, so what tools are available to us, what's the context of this piece of work, and what might you look at doing to help facilitate those conversations. So we go into some of those open-ended coaching conversations, so some of those questions where it just prompts some consideration and some response, and then we go into moments as a use in terms of, could someone experienced in PSRC or a patient safety specialist fulfill this role? Absolutely. You'd be really well placed if you're working within PSRC or an after action review conductor. You'd be really well placed to have these conversations because you'd be in contact with multiple teams, be able to have those engaging conversations, so it would work really well. Yeah, there are other health innovation networks, so doing culture programs. There are culture champions doing some online training bits, and also there is the centralized culture coach platform, which is on the Neo Future space as well. Matt, do you want to come into that any further?
Yeah, I'll just say that in our sort of testing, we did think, how would it be? And there's a wonderful midwife in Exeter who stepped in for us to be help us understand that. And she watched us do a session. Then we had about half an hour of coaching in between that. And then she ran the next session. It's just there was some learning in there for her. She do things differently, but that's to be expected. So it's not going in and going, oh, I know all this. And there's learning every time. Certainly that I've used it. I go, oh, I might tweak that, or I like the way they've said that, so I'm going to shift that, how I present that a little bit. So it's that learning as we go as well. So, but it can be done, picked up quite quickly. But those senior leaders being vulnerable and going, oh, I'm not quite sure, is really, really helpful to the team as well. So there's other bits that sort of play out in that process. So almost being too slick may inhibit it in a way. I don't know if that's I'm allowed to say that, Nikki, but yeah, just being good enough is what I suppose I'm saying.
Absolutely. There's a couple of other things I'm going to pick up on. So there's a question from Natasha about people coming to sessions versus people rostered to be in the space, mandatory versus self-allocated. And there's also a question later on about whether you start with a kind of focus. So I guess you could identify a practice to focus on, or whether you let the team come up with that. I think, again, there's flex around this. I think we designed moments really with the idea that actually you could use something like a safety culture survey as a starting point, or it could be that there is already some insight in a team that's a starting point, or it could be that you actually just have an open conversation and you experiment. So there isn't a single right way, which I appreciate makes it complicated because people are like, well, how do we know we're doing it right? But the point is, it is an open framework to work with, to do that experiment, to almost enhance curiosity and to actually get that sense of what is it that we're doing? Does it feel right? So there isn't a single right way. I think what we've found with our follow-on work, that resourcing is an issue. And I think there's also an issue about who's in the room, and actually how familiar and safe those people feel. So I think rostering could play a part in that, in terms of actually thinking what's going to work well. But, you know, you could argue that impromptu sessions may have just as much benefit as those that are highly organised. So, I mean, again, I think there's flex in terms of where you want it to fit.
I'm just saying that I guess the conversations you have will be different every time. So it's there. I think there's no sort of best way. Who comes. And if they're rostered, that's rostered, and that shows sort of organisational commitment that this matters. If they volunteer and come, it's a different conversation. So both are equally beneficial in my head, and trying to design it can take time and energy and effort. I guess I'm more of that if you build it, they will come. Whoever comes joins in the conversation, and it's a great conversation, and you get out of that what you get out of it, and that really shapes it. And the senior leaders in the room can change that, but if they're in there and they understand and hear firsthand about things, it's really, really powerful. But some sensitivity, the dynamics now, it does feel safe enough for people in that space to share how they're feeling, and that may take some learning and process through that as well. But how those leaders are will really, really shape the conversation, and you can't deny that. But having had a lot of them in the room, they've been really positive conversations. They responded really proactively to hearing things and the insights that have been shared with them.
I think in terms of being volunteered versus voluntold as well, when people volunteer to attend something, you always know that they're going to be more engaged in the process. But especially with culture work, sometimes the people that you would like to engage to help enact some of that significant change around team dynamics, they might need to be voluntold, they might need to be rostered to attend something. And in response to the do you need to have a topic, we went to one of our local organisations who didn't really feel like there was a place for moments within their teams. They thought that actually their culture was quite good. They thought that they already had these conversations. So we just got some of their ward managers together, and the topic they chose was around handover for escalation. And it was quite interesting because when they were talking about their huddle, they hold their midday huddle at a certain time, and said we have our midday huddle at this time, and the other leadership members were saying, well, we identify our areas for escalation and then we present them at the huddle, so we have that the huddle happens at this time. So actually there was a complete disconnect within that department in terms of when these things were happening to enable them to escalate. So although they felt like they didn't need the tool to help with discussions, through that one let's give it a try discussion, they did identify an area for improvement because there was a disconnect in when people understood that that huddle was happening. So it was an immediate piece of learning for both sides, without then necessarily committing to something else. So it absolutely works set topics, but also with letting people discuss what's important to them at the time.
Thanks, Jill and Matt. So I'm conscious of time because we've got just 7 minutes. I think there's a couple of questions that are linked around sort of impact, which are quite interesting. So this is an interesting area because I think somebody else has talked about how do you resist the measure and manage, because I think what we have deliberately, in a way, tried to not think about moments as a product, and actually how do we just, we're doing safety culture work, we're doing moments, because in a way that felt so counterintuitive. The work that we're doing, the follow-on research, we are starting to think about not only the enabling conditions for moments, but also trying to unpack a bit at a social and relational level. How do we know that moments is having a positive impact? So I think there are different ways of looking at it. You can look almost at the practices themselves. So have there been, at a very operational level, have there been any tweaks and changes? And do people feel that's a good thing? There's also about actually how people are being upskilled to use moments, to think differently about safety culture as that everyday moment. And actually, are the teams being upskilled to have those corridor conversations and to prioritise that collective space for reflexivity and criticality in a way that perhaps they haven't? And then, there's obviously more formal ways of measuring that through safety culture or score surveys. So there are different levels that we can operationalise this. But I think what we're trying to get away from is the idea that, moments, we do a moment section and then job done, because it's more about, I think, just enabling people to bring moments in and actually have it as part and parcel of that sort of ongoing work. Yeah. Anything? We've got 5 minutes to go, and I do want to come to the just reflecting before we finish about the infrastructure that is supporting, certainly in terms of maternity and neonatal care. Have I missed, Liz? I know you've been monitoring the questions. Have I missed anything that?
No, I don't think so. Somebody did ask about the longitudinal outcomes of implementing moments. So they ask what resources required to wrap around QI, suggestions emerging from sessions such that ideas generated or implemented, and lack of follow-up change or does not impair the positive culture change that moments can facilitate. So I think, it's about measuring again, isn't it? I think that's something, and then resisting that measurement.
So I think it's also really important, if people are investing time, that they do get a sense that we are taking this seriously, because again, it's any sort of resource that we expect staff, or we hope staff participate in, we need to be clear that it has some benefit. So, but I think for me, it's about localization of that, and actually where does this sit amongst all the other work that's going on, and what is moments doing to add value in that? And as I say, I think watch this space. I think we will be devoting more time to think about how do we meaningfully think about the impact of moments. But I think that point around what resources required to wrap around and ensure continuity and longitudinal outcomes is a really important one. And again, that is part of the work that we're looking at, is what enabling conditions really do you need to actually ensure the success of moments. So yeah, Jill, did you want to come in? I'm not sure who else is on the call, to just say a little bit about that wraparound in terms of there's been lots of talk from the HINs, and that support for people training as facilitators for moments.
Yeah, I was just going to say, in response to the QI stuff, that there's also opportunities, like Matt said, as long as you've got that senior engagement. For perinatal teams, you've got maternity incentive scheme, which looks for quality improvement work. For wider services, you've got the CQC single assessment framework, which is looking for engagement and quality improvement as well. So there are supportive mechanisms in terms of enabling you to get senior leadership buy-in for quality improvement that comes out of moments. In terms of culture as it moves forward, I want to check with Elizabeth before I answer anything in terms of longevity, because I know that Elizabeth is here from the NHSE team, because she's popped a few bits in the chat. So I didn't know if, Elizabeth, you wanted to just, if we can unmute you so you can say how we're looking at the culture moving forward. I'll give you a second.
Hi Jill, hi everyone, thank you. Yes, just to say that the PSC or the HIN support dedicated to the perinatal culture and leadership programme and in helping people to facilitate and train as trainers and really get started on moments within their organisations will be available up until the end of March. That is if you're working in perinatal services. And if you need any help connecting with your HINs and your workstream leads, just drop us an email. I'll put the email to our team in the chat, so please don't hesitate to drop us an email and we'll put you in touch.
Well, I think we're coming up to time now, so just a big thank you again. Also, you will, I think, in the chat, there is also a link to get some feedback about the session. It would be really great to hear people's thoughts on how valuable the session was and any learning for us moving forward. But yeah, I hope it's been valuable for everybody. And thank you, Matt and Jill, for sort of, yeah, really bringing things to life with your own personal experiences. So thank you. Yeah, and enjoy the rest of your afternoon, everyone.